Hello, this is Dr. Do again. This video is still on alphabetic list problems, letter M. Today I'm going to talk about diseases regarding to the mitral valve diseases. Usually when I talk about the mitral valve disease, referring to the adult. It's not children. That belongs to congenital valve disease, and in the children with inborn heart problems. But when I talk about the mitral valve disease, referring to the adult develop this mitral valve conditions. Usually there's some, before I talk about the details of this condition, is there any emergency situation associated with this mitral valve diseases? Yes, the mitral valve disease, either stenosis, regurgitation, or prolapse, all associated with eventually, if not correct in time fashion, will develop heart failure. So the signs, either left or right heart failure, particularly the left heart failure, will back up to the lungs, will cause difficulty breathing. So if that's the case, that's the emergency. What kind of signs for this mitral valve disease caused lung problems, which is the edema, pulmonary edema. Usually the first problem is the right heart failure, and then eventually become left heart also cause the failure, fluid back up to the lungs. So that's the signs I think I mentioned before. Congestive heart failure, difficulty breathing, sleep on more pillows, and also wake up at night to gasp for air, and sometimes cough up this pink filmy sputum. So that's all, and may or may not have the change color of the lips to blue or cyanosis. So those are the signs for this mitral valve conditions associated with heart failure, warrant emergency visit. Can you manage at home? Probably no, you cannot. Even though the early stage, probably after diagnosis, the physician give you instructions, observe, but still need to be followed up regularly for the progress of these conditions. And because if not correct, that will cause eventually the prognosis is not good. And then let me just talk about, after I talk about the emergency situation or the mild condition that I observe at home, let me just talk about in general, all the valves, either the mitral valve, the tricuspid, or the aorta, or the pulmonary valves. When we talk about the valves condition, usually associated with either stenosis or regurgitation, which means not closed tightly, or the prolapse. Prolapse means that cannot hold. The similar consequences of the prolapse associated with the regurgitation, but just that the cause are different. So, and then the diagnosis, I just, because I think I have the same question as you, the murmurs. Usually the valve disease is diagnosed by the listening through the stethoscope auscultation, hear the murmur. And because of the technology, the imaging, the echocardiogram, for example, really can see everything clearly on the motion of the valve, and whether it can close tightly or whether it has regurgitation. Now, what is the value of auscultation, the murmur? I think it's worth to discuss, but I did search the literature, the really current. Still, the classic auscultation hold the specificity and sensitivity, particularly the specificity of above 90%, that's quite high, and the sensitivity about 70%. What does it mean? Sensitivity of specificity, I just bring here. So the sensitivity is really to rule out, for example, there's a test, the sensitivity is 90%. If the patient tests negative with this high sensitivity, so that really means pretty much not have it. On the other hand, the test with high specificity is to rule in. If the test has a very high specificity, but if the test was positive, that's pretty much to rule in. diagnose the disease existing. So in terms of this, if you're interested, you can search 2x2 tables and you search sensitivity, specificity. It's very useful, this idea, either medical or any other field. The reasoning process, the statistic significance of this concept, it's very helpful, I hope. So how to get it, the information, I just present this, the conclusion, the useful part of the final application for this sensitivity and specificity in terms of medical field, but there are details, how to calculate, how to draw this 2x2 tables. So you need to understand, if you're interested, to search and to find out the idea of behind of this conclusion. But anyway, so talk about the mitral valve disease. What are the causes? Usually for adult, really there's still some genetic causes like connective tissue collagen not well developed can cause this valve disease usually, and also the rheumatic fever. That's probably a couple of decades ago, that's one of the most common cause of this mitral valve stenosis, and also some degenerative change or associated with hyperlipidemia or sclerotic, in general sclerosis. So these are the causes. Of course, the risk factors like smoking, alcohol, and hyperlipidemia, any other diseases are the risk factors for this. And in terms of the treatment for the mitral valve diseases, for the stenosis or the regurgitation means the valve cannot close completely. In terms of the mechanism, how to cause this problem, heart failure, if the valve not close enough or is too narrow, that's the mechanical mechanism, the blood, the left ventricle, for example, keep working hard to pump the blood through the narrow passage. If the stenosis, for the regurgitation, that's the overloaded volume, because the blood back up during the dilation process to fill the chamber. So this is complicated. I think it's not just one word or two sentences to explain. But anyway, the consequences is the heart failure. And in terms of diagnosis, of course, pick up by the symptoms and also the auscultation and confirmed by the echocardiogram, and to evaluate the ventricle function. So this is about, in terms of treatment, I think surgical, in addition to the symptomatic management, surgical management is the radical treatment. Depends on the severity of the disease. And so this is about the mitral valve conditions, either stenosis, regurgitation, or prolapse. Actually, other valve disease following the same mechanism, the same rules, or just different cause, different consequences, and the management also surgical for the radical. So I hope this gives you some idea about the mitral valve, the fundamental knowledge, even the statistic of the sensitivity, specificity. What you probably heard it a lot from your physician, and I just give you the idea of what really they mean for the sensitivity or specificity. You can search more. So I'm going to stop here, and I hope it helps, and thank you for watching. I will see you next time.